The Fairbanks Opiate Workgroup will meet the morning of August 17th, beginning at 10 o'clock in the Noel Wien Library auditorium. Fairbanks Police Chief Randall Aragon says there are between 300 and 400 people living within city limits that are addicted to some form of opioid. Heroin is the leading form that is abused in Fairbanks. The primary goal of the mid-August meeting is to brainstorm ideas for action as well as to identify gaps and barriers for successful prevention and treatment. The work group is forming a steering committee and developing an action plan for the Fairbanks area. A wide array of stakeholders have been invited to the meeting. U.S. Surgeon General Dr. Vivek Murthy joined Senator Dan Sullivan at a wellness summit on opioid abuse last week in the Mat-Su Valley. Murthy says funding designated to specifically combat the opioid crisis is available to the 49th state.
The Department of Health and Human Services has been putting more and more money to states and to local communities to expand treatment. Just a few months ago, the Health Resources and Services Administration announced $94 million in new funding to expand treatment. $1.7 million of that was in fact directed towards Alaska.
Our communities are at risk, and we need to take action to make sure we don't end up like other places that you read about in Kentucky or Indiana or Ohio that literally have been just devastated.
I'm going to end my trip in Alaska knowing that the strength of Alaskans is far greater than the magnitude of the opioid crisis, as big as that is.